All right. Now that we've covered the basics of generalized anxiety disorder, discerned between fear and anxiety, and kind of looked into the DSM-5-TR and how generalized anxiety disorder disrupts one's quality of life, potentially, let's talk about the specific diagnostic criteria and features. So, something important to note before we get into things is that a clinician can diagnose generalized anxiety disorder only when the full set of DSM-5-TR criteria are met. So this means the symptoms cannot be occasional, short-term, or just based on one stressful event. Instead, the diagnostic process requires evaluating duration, severity, impairment, rule outs, and symptom patterns. Before diagnosing, it's important to consider that all criteria must be considered together, and no single symptom confirms generalized anxiety disorder. That is to say, if somebody just meets criteria A and not the rest of the criteria, that does not mean that they have generalized anxiety disorder. Symptoms must also be must be present for days, more days than not for at least 6 months. And a clinician must assess whether the worry is persistent, excessive, and difficult to control. The symptoms must cause clinically significant distress or functional impairment. The symptoms cannot be better explained by another condition. A comprehensive assessment can include clinical interview, mental status exam, client history, collateral information, and standardized measures. So, using a comprehensive assessment may help you better to determine whether somebody has generalized anxiety disorder. And now let's get into the specific criteria which can be found in the DSM-5-TR. So, criteria A is excessive worry. And again, there's emphasis on the operative word here, excessive. It must go beyond normalcy, and it must be for more days than not, so the majority of the days, and at least 6 months or more. That's the minimum duration. So 6 months is the magic number when it comes to generalized anxiety disorder. Has this client or patient been worrying excessively for 6 months or more for the majority of the days? Additionally, the worry must be about multiple events or activities. So, work, school, life responsibilities. In general, the more narrow the worries about one specific category, the less likely generalized anxiety disorder is to be the culprit. So, for example, if somebody worries specifically about their perceived evaluation in the social domain, that may indicate something else, such as social anxiety disorder. So, broader categories are more likely to indicate generalized anxiety disorder. Another important feature is criteria B, that there's difficulty controlling the worry. So, the individual finds that it's hard to control their worry. They try different strategies, and it's hard to tame this beast. So, criterion C is physical and cognitive symptoms. So, from the following list of 6 criteria, 3 or more symptoms are required in adults. And when working with kids, it's important to note that only one is required in children. So, restlessness or feeling keyed up on edge, that's 1. 2, fatigue or feeling easily tired. 3, difficulty concentrating or mind going blank. 4, irritability. 5, muscle tension. And lastly, 6, sleep disturbance. So this can be difficulty falling asleep, staying asleep, or restless sleep. Now, criterion D is clinically significant impairment. So symptoms cause stress or impairment in social, occupational, or other important areas of functioning. So we're not talking minor inconvenience as we're talking legitimate impairment in these domains, clinically significant impairment. So, for example, in the social domain, the person who has generalized anxiety disorder may completely avoid going to parties when invited, or they might avoid stepping into an elevator if other people are in there, etc. Criterion E states that the symptoms are not due to a substance or medical condition. So if somebody is diagnosed with generalized anxiety disorder, the symptoms cannot be attributable to substances such as drugs or medication, and not be explained by a medical condition like hyperthyroidism, which might mimic some of the symptoms of generalized anxiety disorder. And criterion F states that to receive a generalized anxiety disorder, the symptoms must not be explained by another disorder. So some other symptoms to look out for that generate similar symptoms include, the other diagnoses that might produce similar symptoms to generalized anxiety disorder to be on the lookout for are panic disorder, socialized anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder, separation anxiety disorder, and other anxiety-related conditions. And as we'll discuss later, it's important to note that there are other mental health conditions that can co-occur with generalized anxiety disorder.